With life, bending, twisting, lifting, jumping, the cartilage of the knee joint wears out just like any other joint, and as the cartilage wears out, we develop osteoarthritis of the knee. And if it is grade 1, grade 2, grade 3 osteoarthritis, we can do well with simple growth factors amniotic allograft. But if it is grade 3 to grade 4 osteoarthritis, we need more than that. So if it is grade 1 to 3 with tenderness of the joint line of the knee, we can simply do prolotherapy of the knee capsule on the both medial and lateral aspect, or whatever is needed, along with the amniotic allograft inside the knee, and the patient will be very happy. However, if the patient has just really bad intra-articular knee pain, we just want to go for stem cells and or the umbilical cord cells and matrix. Umbilical cord cells and matrix are the easiest, they're safest. They do not put your practice at risk, because you are not doing anything invasive in there. You're just taking something out of the vial and injecting. So the safer injection means safety for your practice and patients, and that makes all the difference.